Well, I think the decisions that this congregation needs to make will be based on what are your goals? What are the values that you're basing your goals on? Is this something that you want to do to make sure that all the people in your congregation who want to worship in person are able to do so safely? Is it inclusive of everyone in your congregation? There's more and more studies that show that the Pfizer and Moderna vaccines actually decrease asymptomatic infection. The initial clinical trials weren't aimed to show that, but the post-trial studies that are done in the real world, in real-world settings, show that it decreases the infections actually that people get, so they are not likely to spread the illness, which is just a wonderful thing to know. So when people are fully vaccinated, they have more freedom now not to wear masks and not to do social distancing in certain situations. And that's important because when they people are vaccinated, they can go about living more of a usual life, more like it was before the pandemic, which we're all eager to get back to. But in a setting that is mixed, it's still possible for someone who has been vaccinated to have breakthrough infection. And I'm seeing different figures about how many that is, but it could be up to 5%, but it's likely less. And so those people still are at risk for transmitting illness, the virus that will cause illness to people. And the people that they would want to prevent the transmission to are going to be the people if they got infected, would be at great risk for severe illness or hospitalization or death. So people who have been fully vaccinated, it is a recommended thing that when they are around them, those high-risk people, that they continue to wear a mask. Some of the studies show so far that people who take certain medications that suppress their immune system, like rituximab or mycophenolate, there may be others, that it suppresses their immune system enough is that they don't respond as robustly to the vaccine as someone with a normal immune system. This is also true of people who have blood cancers, leukemias, or other hematologic cancers, we call them. And then it would be true of people on hemodialysis. Those are the studies, the good studies we have so far, that show that these folks are not responding as well to the vaccine as someone with a normal immune system. Now, it's likely that some vaccine for these folks are better than no vaccine. But these people who have weakened immune systems should continue to practice behaviors that would decrease their risk for exposure. So they should continue to wear masks when they're around others, practice social distancing, and stay away from groups of people where there will be others who are unvaccinated and may have COVID illness that they are unaware of. Either they have asymptomatic illness or they've gotten recently infected and they just haven't developed symptoms. These are the people they need to be careful about being around. So we have some serious concerns about these variants that are beginning to circulate in Arkansas. So when the mutations are such that it helps the virus stick more easily to the human cells and gain entry, those viruses are more easily transmissible. They can cause more infections more quickly. And then some of them have been shown to actually cause more severe disease, increase people's risk for death, including people of younger age. There are two that I am particularly concerned about that are circulating in Arkansas. One of them is called the Alpha variant now. It was originally identified in the United Kingdom, and it has quickly spread to numerous other countries and become the predominant variant, and that is what we are seeing in the US. Now, this variant causes more severe disease and increases risk for hospitalization. There's another variant that has come out of India called the Delta variant, and it appears to be 40 to 50% more transmissible than the Alpha variant. And we don't have very many yet in the United States, but the experience in the United Kingdom, which has really good sequencing capability for the various viruses to see what variants are circulating, they predict that it will surpass and overtake out the Alpha variant and become the predominant one. And it apparently causes severe disease in younger people. So I'm concerned about these variants. What we are learning, though, is that the vaccines work pretty well against these variants. There are studies that show that there is some reduced what we call neutralizing antibodies. So when someone gets the vaccine, it stimulates the body to produce antibodies that block the ability of the virus with its spike proteins to attach to human cells and cause infection. So it's what we call neutralizing antibodies. And so when you take someone's blood who's been vaccinated, you can see what level of neutralizing antibodies they have. And it's not quite as good against these variants as the original historical variant that has been traveling around, but it appears in the studies that it's good enough. And so for instance, the Pfizer vaccine seems to be very effective in the Alpha and also the Delta variant. So if we can get people vaccinated, then it will help stop the spread of these variants in Arkansas. And these are the ones that, of course, we're most worried about in congregate settings because they're so much more easily spread than the ones that we're used to being around in our experience over the last year with the original variants that have come through Arkansas. So the CDC says that anyone who is fully vaccinated, and that means 2 weeks after a person's second dose of the Pfizer or Moderna vaccine, or 2 weeks after their 1 dose of the Janssen vaccine, they would be considered fully vaccinated. And these folks, in certain situations, can go without a mask and they don't have to practice social distancing. So of course, getting together with a group of people who are all fully vaccinated, then you don't need to wear a mask or practice social distancing. And then if you're in a setting where there are a few people who are not vaccinated, the person who's fully vaccinated could go without a mask or not practice social distancing. So those are the two main situations. Now there's other considerations where they still need to wear masks and social distancing. That would be in a healthcare setting where they're around a lot of people who are at risk for severe disease. Then someone in that setting, even if they're fully vaccinated, needs to wear their mask and practice social distancing, of course, unless they're providing care to that person. So that's one of the considerations for people who are fully vaccinated to go about their daily life. So if they are around someone that they know is at increased risk for severe disease, and I would encourage them to wear their mask around them and practice social distancing when it's possible. There's other situations, such as when they're out in public, say in a grocery store. You know, the people who work in the grocery store do not know who's been vaccinated. And so out of respect for them, I would encourage everyone, when you're in a large group, mixed situation where some people are vaccinated, some people aren't, and you can't know who is and who isn't, for everyone to wear a mask and practice social distancing. In the situation of a congregation, the congregation will need to look at their own particular situation and decide what their goals are, what their values are in terms of including everyone or not, and then is this something that is realistic? You know, there are some congregations who have great difficulty wearing masks. There are other congregations where it's no problem at all. So a congregation itself will have to make up their mind, what are they going to do together in order to keep everyone safe. So in a situation where we still have a number of children who are not vaccinated, of course, there's no vaccine for them, all of those children need to wear masks and practice social distancing. And that will be much easier for the children to do if the adults are modeling the behavior. In addition, if there are people in the congregation, even just one, I would count that person as being of high value, just like the Good Shepherd does, and protect that person and have people wear the mask and practice social distancing for the sake of that one person. Well, I hope that there will be a large proportion in this congregation who will be vaccinated. I think that's one of the best ways to prevent the spread of COVID-19 with singing. And then everyone would need to wear a mask. Now this is important for a couple of reasons. One is if you expand singing, singing creates aerosols. So it's not just little droplets that fall to the ground near a person. The aerosols get in the air and they linger in the air. So the more songs you sing, the greater the buildup of aerosols. So you would have to think about how many songs do you want to sing and how good is the air circulation in the church building to prevent the buildup and accumulation. So the idea that you would sing and then leave actually is a pretty good idea, because the aerosols that would have built up, people would have exited that area. So if you're going to think about singing more, then there needs to be a consideration to get as many people vaccinated as possible, and then people wearing masks and practicing social distancing and making sure that the air circulation in the congregation is as good as it can be. So unmasked singing in a mixed vaccination group at this point in time would be a good way to have an outbreak of COVID-19. And we say this based on experience we have in congregations in Arkansas that have done that and had outbreaks. And we know that COVID-19 spreads very well through singing. And if there is just one person who has COVID-19 infection and they won't know it, they may not have symptoms or they may not have developed symptoms yet, then I think that the likelihood of the spread will be very good. And if they happen to have one of the new variants, then the likelihood of spread will be excellent. And I know that this congregation does not want to experience what other congregations in Arkansas have experienced, with members of the congregation actually dying of COVID-19 that they got at church. So there's a few misconceptions that I hear about. One of them is that people can't afford the vaccine. And the vaccine actually is provided to people at no cost. So it doesn't cost out of pocket for anyone. If they have insurance, the vaccine provider would like to be able to bill the insurance, but no one will be turned away from getting the vaccine for inability to pay. The other thing is that they want your ID so they can properly enter your information into the vaccine registry, but if you don't have an ID, you can still get vaccinated. So that's very important. The other thing that surprises me is that people think that the vaccine itself can give a person COVID-19, which is really not possible because the vaccines don't have the COVID-19 virus in them. And I'm glad, because that would be a very dangerous virus to make, right? Or very dangerous vaccine to make, I mean. But they really don't work that way. They stimulate the immune system in other ways. So that's important for people to know. I also hear that people think that if they've had COVID-19, they don't need to get vaccinated. And what we have learned is that the immunity wanes. We aren't sure how long the immunity for natural infection lasts, but there are documented cases of people getting infected more than once, although that's not common at all. So there could be lasting immunity. But when you measure the neutralizing antibody from people who have gotten natural infection and compare the neutralizing antibodies from people who've been vaccinated, the people who are vaccinated have higher neutralizing antibody. And that may be very important to have on board this extra this cushion of neutralizing antibody for these new variants. So even if people have had COVID-19, I encourage them to get vaccinated in order to have the higher level of neutralizing antibody. Another thing that I hear is for the vaccines that cause the side effects more often, it's the Pfizer and the Moderna, the 2-dose vaccines, that sometimes people will have a side effect from the first dose and they decide not to get the second dose because they don't want to have worse side effects. And of course, more people do have worse side effects with the second dose, but that is not necessarily the case. I know I had a sore arm when I got my first dose, and when I got my second dose, I couldn't even tell I got it. So I know that there's a difference, and it's not necessarily that the second dose is always worse than the first dose. But what happens sometimes when people get the first dose, About a week after they get their dose, they'll get a big red area in their arm. And they'll decide not to get the second dose because they think it's going to be a lot worse, or this red area is an allergic reaction. That means they shouldn't get one, but that is not the case. That does not mean they can't get the second dose. And strangely enough, that second dose doesn't seem to do the same thing for that first one with that red area. So a lot of people think they shouldn't get the second one, or some doctors who are unfamiliar with this phenomenon, they're not familiar with the vaccine or side effects, may advise their patients to not get the second dose. And so we're trying to educate doctors about this delayed reaction to the vaccine so people can still get that second dose. Oh, there's one more I wanted to mention. There's been a lot of information on Instagram and other social media about concern that the vaccines will decrease a woman's ability to have children in the future. And that's just not true. There's no medically plausible reason about why that would happen. And I'm sure that all the women who've gotten pregnant after they've gotten vaccinated will be surprised to hear that it has a decrease in, fertility, because it doesn't. So the OB-GYNs do recommend these vaccines. And I can tell you that recently in Arkansas, we've had several women who are pregnant who have become critically ill in Arkansas due to COVID-19, that if they had gotten the vaccine, that would have been prevented. And we just don't want to see anyone go through that.
Thank you very much for being here. It has been a wonderful time to spend with you, and we are so very grateful that you chose to spend your Friday evening sharing all of this information with us.
Well, you are very, very welcome. Thank you for having me.